speech number 2. Alright. Uno, dos, tres, cuatro, cinco. Nope. Right now, can we,
You can be quiet and please listen to my speech.
Good.
The next 5 to 6 minutes. So approximately 443,000 men and women will die this year from cancer, and of these, 159,480 will be from lung cancer. The leading negative form of smoking cigarettes is cancer, and it comes in many forms. And like you saw in the statistic above, the main form is lung cancer. I'm no scientist, but I have thoroughly researched, the different cancer types, and along with the negative effects and statistics that come with it. So the information I'm giving you, it does come from credible sources. It comes from WebMD.com, cancer.org, and cancer.gov. I'm here just to inform you of the different types of cancer that comes from the negative effects of cigarettes, as well as the statistics that come with it. They come with the lung cancer and the ways that cancer can be treated. So the information that I'm going to give to you, it's not very detailed, it doesn't go very in depth, but it does cover the bases and informs you of the main types. I don't want to confuse you or misinform you of anything, because that would just be terrible. So cigarettes, they can cause many forms of cancer, primarily with the upper respiratory and nasal as well as oral cavities. Cigarettes can form any part which comes in contact with smoke and tar. So everything that is connected and everything that comes in contact with it can be harmed. That's your lungs connected to your nose, esophagus connected to your stomach, which is then connected to your bladder and other parts of your body. And 30% of all cancer deaths are from cigarette smoking. So your oral and throat cancers, it's going to be your nose. So with your throat is your nose, nasal cavity, sinuses, and your esophagus. And with your oral, it's going to be lips, mouth, and tongue. You see those people walking around with a little hole in their throat. It's because they got cancer. They can't talk anymore. And then your lungs, it's kind of the main thing you kind of hear people talking about. 87% of lung cancer deaths are from smoking, and then the smoke's just gonna go and get all black, and your lungs are just gonna slowly deteriorate and just become filled with tar. So, as I said, lung cancer is the leading cause of cancer smoke in smokers and can impact secondhand smokers as well. So, with direct contact from the lungs of people that actually smoke, it's going to decrease your lung capacity. So that way you can't breathe as much, and it'll be harder to run, harder to swim, and your lifespan is going to be about 10 to 15 years shorter. And then for secondhand smoking, there's side stream smoking and there's mainstream smoking. Side stream is from the tip of the cigarette that is lit, while mainstream is the side, and when people blow out all that smoke at you, that's mainstream smoking. And side stream smoking is actually worse, 'cause even though there may not be as much smoke, there's more carcinogens, which is the chemical that creates the cancer-causing agents. And so those actually do more harm to you than people actually realize. And then you also have asthma and lower respiratory infections, and these are primarily evident within newborns. Babies 18 months and younger are going to be affected by your secondhand smoke. Roughly 150,000 to 300,000 newborns are affected each year, and 5 to 10% of these end up in the hospital. Not necessarily dead or with cancer, but they can also have heart disease, asthma attacks or whatnot. And then cancer from secondhand smoke kills about 34,000 non-smokers each year. just keep that in mind when you're ever around smoke or you are smoking, that you kind of keep it away from people who don't want to die or get cancer from it. But the good thing is that they have come up with treatments for it. There's no like 100% cure, but there are ways to take away the tumors or to get rid of the cancer and put it into remission. The main one is chemotherapy. It's a medicine that comes from a machine, put over, you just kind of take it in for a while. It's going to go inside and outside the lung area and kill all the cancer cells. There's 10 different main forms that they use. All vary and there's specifications, and I'm not going to go into that because I don't want to confuse you or get you mixed up. They have really difficult long names, and quite the pain. And then there's also radiation. There's external radiation therapy, which also uses a machine, and it's going to go in and kill the cells as well. And then there's radioisotopes, which they take like a tube and like put the little radioisotopes into you. It's also called internal radiation therapy, and then those little isotopes are going to go around and be put next to the tumors and then kill it that way. There's also other ways called like radio frequency ablation, which basically kind of heats up the cancer cells and then kills them that way. And there's also laser therapy, which doesn't kill or doesn't cure lung cancer, but it does get rid of the tumors inside of you. So, I hope I've informed you enough of the different types of cancer smoking cigarettes can cause, as well as the statistics with the lung cancer and a few of the ways cancer can be treated. Take this information with you and spread it to people that you know, spread it to people that smoke cigarettes, friends, family, and just make them aware of the risk that they can potentially be at. And for those of you who smoke, I hope you realize that you are at risk and that you're also putting others at risk. And I hope you just take this information and realize the impact of the decisions that you're making. And I encourage you to do your own research and further investigate into the specifics on the cancers, and as well, especially into the treatments of the cancers of lung cancer and the negative effects of cigarettes. So thank you all for coming out. Hope you enjoyed the speech, and have a nice night.